Hi everyone. Today we're going to talk about the perfect period. I'm here with Rigi from She Evolves to Empower.
Hello everyone. My name is Rigi, and I'm one of the co-founders of She Evolves to Empower. And our platform is a platform where we want to empower women globally and help educate them and help motivate them and inspire them.
Yeah, so I was so excited when you wanted to collaborate on this. I know a lot of women have questions about their period. So I'll just start with what does a perfect period mean to you?
So a perfect period to me means a period that's not painful, no cramps ideally, and where we're feeling in a happy mood, where we're not always constantly hungry.
Yeah, and periods are your fifth vital sign. They show you your underlying health. And so it's possible to treat underlying causes of painful periods, for example, so that you can get to being pain-free, having great energy, um, all during your menstrual cycle. So let's get started. There's a lot of things that play into your period. It's regulated by hormones that start from your brain, go down to adrenal glands, which are little glands that moon-shaped glands that sit on top of the kidneys and respond to stress, and also the ovaries that produce their own set of hormones. So these are just a few of the organs involved in your endocrine system. So the secretion of hormones that regulate your period. You'll see the thymus there and the thyroid as well. So the thymus is a big part of your immune system, and thyroid regulates your metabolism. So all of these aspects across the month can influence the period that you have. This is a picture of your uterus. So I was surprised at how little I knew about anatomy coming out of high school even. But so your uterus, it sits right in your pelvic region. You can even check your ovaries yourself. You just put thumbs right in your belly button and let where the pinkies lie is approximately where your uterus is. You can try to feel for your ovaries yourself. It's easier in a skinny, lean frame to find them, but anyone can push with the right texture and try to feel their ovaries. And they're more easy to feel around ovulation. So this is what is happening across the course of a menstrual cycle. When you start with day one that you bleed, you head towards ovulation where an egg is released. If this egg does not implant, then eventually the uterus lining secretes. So we're going to get into some of those details. This is another picture of your hormones and how they change across the month. So we talked about the follicle developing, ovulation happening with the egg being released, and then progesterone rising and building up that corpus luteum. So you'll see on this slide, we talk about these hormones called follicle stimulating hormone and luteinizing hormone. So these are secreted from your brain. And that's why stress on your brain can influence your period. And then your hormones, estrogen and progesterone, they also ebb and flow during the month. And these hormones each have a totally different profile to them. They're going to make you feel different things. So if one hormone is out of balance, it can cause period symptoms. So for example, you might have low mood, or you may have breast tenderness because of an imbalance in these hormones. For any girl on a birth control pill, these hormones are actually flatlined. So there isn't this up and down happening, and you're not having a true period because ovulation is suppressed if you are on hormones in birth control. All right, so this is another picture explaining how stress affects your brain, and that can have downstream effects on your adrenal gland, which is involved in secreting hormones that can impact your period. So if you're stressed, oftentimes people will notice that their period ends up being later, or they have a worse cycle than usual because of this hormone called cortisol. It's possible to measure cortisol for yourself across an average day and see if it's rising and falling in the appropriate order. If it's not rising and falling in the appropriate order, then you might be dealing with insomnia. If you have low energy, it could be burnout. So that's what you see in this picture with the patient. It's low cortisol secretion. They are likely burnt out. Or if it's super high, you're in that stressed phase where if you continue super high for a period of time, you could end up being burnt out.
So what's a good time frame to know how much your period is delayed? Like in your stress levels, like when's the indication that you need to get it checked out or something? Like if you haven't, what's like the period of
Yeah.
delay you're
So
concerned
the
about?
best thing to do is to be tracking your cycle on an app. So the
Yeah,
average period is about 28 days. If
yeah,
you end up around 31 days, certain months, I wouldn't flag that. In some cases, that longer cycle can be a sign of something called polycystic ovarian syndrome, in which these hormones are also affected. But the best thing is to start tracking your period. And then if it is over 31 days often, that's something to talk to your doctor about. All right, and so here I'm going to talk about some of the sex hormones that play into your period. We've got estrogen, progesterone, and testosterone, and your body metabolizes each of these with your liver. So it's possible to have healthy metabolism, so these hormones and their effects are cleared out of your body, or it's possible for your liver to be overburdened, your cup to be full, and you're dealing with some of the more toxic issues of having high estrogen levels, for example. And so in a PCOS state, you're typically seeing testosterone being elevated. Testosterone is that androgen hormone that gives you a good sex drive, good energy, but it can also cause extra chin hair growth. It can cause male pattern balding. So it's important to see your hormones. And that high testosterone piece, you can support your body in regulating that by working on your sugar intake, your metabolism, all of that impacts the levels of testosterone.
So which hormone would you say is in charge of like the acne, or is that a combination of factors?
So it depends on when the acne is happening in your cycle.
Yeah.
If the acne is happening mid-cycle, it's going to mean something different from the end of the cycle. But if you're having those cystic lesions, that's commonly high testosterone that is to blame for the cystic lesion. So that's a great question. Sometimes if estrogen is not being cleared well, then you might be seeing acne mid-cycle. And so for this patient, they are not clearing estrogen well. They're producing a lot of the proliferative type of estrogen that's associated with growths.
Yeah.
We want to metabolize the healthy estrogen, that's the green part, by supporting the liver with detox. And progesterone is your hormone that's anti-stress, it's relaxing, but progesterone can sometimes be low if someone's in a state of chronic stress because your body is so busy producing cortisol, progesterone gets shunted. It's more important to fight the bear, for example, than have your period. So that's what's happening in that situation. So let's talk about the phases of your cycle. So a typical menstrual cycle is about 28 days long. You can split it in half, with the first half being the follicular phase and the second half being the luteal phase. So day one of your cycle is the first day that you have menstrual flow. So not necessarily spotting, but actual period flow. And initially, day one, your levels of estrogen and progesterone are low. And so that can be part of why your mood may not be great. When estrogen comes down, you can see effects to immunity. Some people get flu-like symptoms around that time as well. So that tells you about your underlying health. If there are some viruses that are causing issues, for example. But as you progress through the follicular phase up towards ovulation, you start feeling lighter, less weighed down because you've had your flow, you've had your period. Having a healthy period is a great detox pathway for your body. It gets rid of a lot in that. But estrogen is rising up until when you ovulate. And when you ovulate, you're feeling your best. So here are some recommendations to support you during your follicular phase. So coming towards ovulation, regulating your blood sugar can be really helpful to having a good ovulation. So that would mean starting out your morning, breakfast and lunch with good protein and plant-based fats. The follicular phase is a great time to be doing those energetic exercises like cardio. Your pain threshold is lowered because there's extra testosterone at that time. So you can go out and do your most intense exercise during your follicular phase. And then it's good to know that your mood and brain function are also boosted with that estrogen there. So this is a good time to schedule interviews, getting towards the end of the follicular phase, specifically ovulation.
That's awesome to know.
Let me double check if I'm recording.
Okay. Yeah, it is recording. Top left
Okay.
corner.
Okay, thank you. All right. So ovulation occurs at approximately day 14 of a 28-day cycle. So this is when estrogen peaks and you're feeling your best, and then progesterone also starts to rise. And some women do feel a dull pain during ovulation. That's not normal. That's something that we can support with getting your hormones in balance, but it is also something that tells you that you've ovulated. I've put the moon in because the moon also has this 28-day cycle. It changes across a month. Some women notice that they ovulate with the full moon. And it's a myth that that's the most fertile time. Other women will ovulate with the new moon. It's just a matter of getting to know your cycle and where you're at. And then you do release the cervical mucus that's at its slippery and most stretchable. So that means it's very easy for sperm to swim through and for you to get pregnant around ovulation. And after ovulation, your temperature rises about a half to a whole degree. And that's a sign that progesterone is rising and you're having a healthy period.
So speaking of temperature, how effective would you say the basal body temperature, the measurement to test out your ovulation, is in tracking your period?
I think it's a great suggestion, especially if you're doing it right, or you're monitoring your diet, your lifestyle right before, because for example, if you're consuming a lot of alcohol, that could throw off your hormones and throw off your cycle. But otherwise, basal body temperature, so that's you taking a measurement right when you wake up before you even left your bed. It's a good idea to help you get some more information about your period and your hormones, specifically progesterone, because you should be getting that rise. If progesterone's low, you may notice a rise and then it suddenly drops, or you may not get a rise at all in the temperature in your cycle. And then we start, after ovulation, we get into the luteal phase. So that's the second half of your cycle. So during this phase, there's a drop of estrogen and a rise of progesterone. The progesterone causes your cervical mucus to thicken so that it's harder for sperm to travel and enter the uterus and for you to get pregnant. And then you can actually see that the cervical mucus is thick, creamy, pasty.
Yeah.
Some women are able to actually feel their cervix, which is farther in your vaginal canal. It feels like a little nose tip, so they can actually feel that the cervix is closed and firm and lower than earlier in the month. So your uterus is actually tilting a little. So during the luteal phase, we already talked about temperature. Some women get this breast swelling and tenderness. Not normal, not healthy. Please address that with your naturopathic doctor if you're getting breast swelling and tenderness. You may feel less social and outgoing during that time. You're more sensitive to pain during that time. So, and a lot of these symptoms can actually be addressed by having a good diet. So in the follicular phase, it was okay to cheat a little bit, but in the luteal phase, you really should be sticking to food that is easy to digest, food that doesn't include any of your sensitivities. Consuming well-cooked foods is really easy on the digestion. And then magnesium-rich foods like chia seeds and raw cocoa, all of these help you with reduce uterine cramping. Magnesium helps you reduce uterine cramping. If you're doing exercise, things like yin yoga and nourishing restorative exercises, this would be a good time for that, because exercise can be a stressor. It can increase cortisol, which can throw off your sex hormones and delay your period if you're quite stressed. So you'll see with a lot of athletes, sometimes they do end up skipping their period if stress is out of balance. This is my big tip. It's to start tracking your cycle. It's the best thing you can do, especially before going into the doctor, so that you can give them all that data.
Yeah.
And then also protecting yourself from endocrine disrupting chemicals. So things like parabens, phthalates that are in a lot of soaps and shampoos and fragrances, all of that gets absorbed right through your skin and they act like hormones in your body. So the cleaner products you can use on your skin, the cleaner environment you can have, it's going to help you have balanced hormones. And then sweating is also another great way to detox. People often use sauna for that. That's me. I practice at Naturopathic Family Health in San Jose. and I focus in endometriosis. So if you have any questions, send them my way.
Awesome. Thank you so much for giving us like amazing informative talk, because I know periods are such a iffy topic for so many women. And we have some questions from the poll that 2 people asked that I want to ask. So it's one of them is about mood. So can depressive episodes be triggered by PMS?
Yes. So oftentimes, if coming towards the end of your period, estrogen is still high and progesterone is quite low, you might be having a mood swing, you might be more depressed. So that to me is a sign of hormones out of balance. So it's called PMSD, depressive type of estrogen. Yeah.
So what are some things that someone who's undergoing this can do to counteract this or alter, like change this?
Yeah, so stress management is a great way to start, and being regular with something like breathing exercises in your luteal phase to prevent this from happening again is a good starting point. In addition, working with a naturopathic doctor to get started on certain herbs that boost progesterone, like Vitex, for example, can be a consideration to prevent that depression premenstrually. And looking at how you eat. So cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts, if you have them well cooked, not raw, they can be helpful in clearing out that excess estrogen.
And another question that we have is it normal to have long menstrual cycles over 38 days? And what does it mean?
So it's not normal. Long menstrual cycles are often seen in PCOS, or if you're quite stressed, you're going through an exam period and you end up skipping your period, or if you're close to menopause. And then it's normal if you're close to menopause, because you're getting to the point where you're not going to have a period at all. And so then the period gets longer and longer.
So you're definitely saying
you should target a 28 to 30 day cycle and target it naturally. So I'm not saying that you should be taking birth control pills to regulate your hormones. In fact, birth control, if prescribed at a young age, so to teenagers and adolescents, if it's used for a long period of time without dealing with the cause of why periods were low, you could have lower bone mineral density, because those are your best years to be accruing bone mass. You need estrogen to have strong, healthy bones. And also looking at your diet that can help you have a regular period. So for example, I've had vegan patients who are vegan before, deficient in certain nutrients like B12, iron, vitamin D. All of that can be part of why someone's cycle is long or missed.
That makes sense. Thank you so much for answering all these questions and giving us and the viewers so much information. So if they want to reach out to you, I'll send them your contact details.
Yeah, that's great. Well, thanks so much for having me. This was so much fun.
We should definitely do more topics.
I would love to. So if anyone has any topic suggestions, send me a message or Reggie a message at She Evolves to Empower. I love your Instagram page. It's so motivational.
Thank you.